Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you've found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Welcome back to part 3 of our ongoing conversation with Wayne Orchard, a partner and executive vice president with Lyric Health. Lyric is our provider for virtual healthcare, and we've been taking a deep dive into telemedicine and how virtual healthcare works. So if you missed those first 2 episodes, please go back and bring yourself up to date. We're going to conclude that conversation today. Do you see a future need for, since we're talking about future, do you see a future need for bringing more medical specialties on board, cardiologists and, obstetrics, pediatricians? There's all kinds of specialties out there. Do you see a market for that?
Yeah, and the certain specialty markets are already using telemedicine within their own offices, to expand that out. I think what we're probably going to see next with the specialist is more peripheral devices. One thing that we're looking at with our Lyric Lean and even our virtual primary care is with the subscription, having a scale sent to someone's house that does the BMI, calculations and all, for somebody. But I know myself, I've got a blood pressure cuff that just, you could slap it on your wrist. Right. And check. So those we have already established, and this is years, and this is actually before the pandemic, remote monitoring care. So those items that are Bluetooth capable, right, in for clients that want to kind of flip that switch, we've got those dynamics set on the technology side, behind the scenes. And so I think that
there's so much of that out there. I mean, you can even take an EKG with your telephone, blood oxygen level, clip those little things on your finger. There's so much you can do at home. I have type 2 diabetes, and when I take my blood glucose readings multiple times a day, it Bluetooths over to my telephone, and my diabetic nurse with my Medicare provider monitors all that stuff, and we have phone conversations once a month. So,
yep. Yeah, exactly. So I think that's probably where the next step is not necessarily just the specialties, right? But specialty care within just your primary care, that diabetic. Well, let's get you, situated with home testing and stuff. That red flag comes up. Oh, there's something off. Larry, how's things going? Right. Because it's usually something else underlying, right? Of what's changed there. And that's where a primary care provider is the quarterback. Really, they help guide, the teams along. But if the information, and one thing the care team does is if we send someone off to a cardiologist or any kind of specialist, is getting that information back into the person's member portal, into their health records, not only for them, but also for their doctor to be able to see, oh, okay, this is what's going on. Do I need to adjust maybe some other medications that, right, maybe cause interaction and all? So that primary care provider really is critical in making sure someone's overall health, even if they're not doing the specialty.
Mm-hmm. This may seem like I'm getting to the end of the conversation here. Before we wind down, I had one kind of rabbit trail I wanted to go down. I'm in, as you can see, my office here. I'm in my home in the Pacific Northwest, and I have a second home in the Midwest. in North Texas. But up here, naturopathic medicine's a big deal. One of the largest naturopathic medical schools in the country is right here in the Seattle area. And I'm curious if there's any future or you see any opportunities or have ever considered moving into those types of realms, naturopathic medicine, functional medicine, things
Yeah.
like that.
Yeah, no, and I think that, another area is going to be going down that avenue. At the beginning of the podcast, we talked about feeling a need, and that's, as a, company that, we have 4 partners, we run, lean and mean. It's all about business sense, as we saw, of how do we guide through what's the next steps, where we put our resources, into. And so this has been a topic that has come up, and as more need gets out there, then the more interest of, okay, yeah, we need to fill this. Because one thing that we always have to be concerned about is we're in all 50 states, right? So we cover, we cover all states. So the need, we can't just say, oh, well, the Northwest, and it's just going to be for them, right? Because just as yourself, well, how about when you go from the Northwest and you're in North Texas, right? Well, the virtual care doctor, if, you're doing, what they call, the care path, no matter where you're at and going, that's where you need the care at. So as that need grows more and more, then that's when that solution will be put out there. But yes, that's one of the things that we've got tagged on our road path.
Oh, good. That's good to know. For those that aren't aware, allopathic medicine is your regular doctor. That's what medical doctors are. They're allopath. They practice allopathic medicine. Naturopathic medicine is different in it, where an allopathic doctor focuses primarily on treating what the symptoms are and relieving the symptoms. A naturopathic doctor's got to focus more on what caused the symptoms in the first place. And about 26 states in the United States have roughly a little over half of them actually license and regulate naturopathic doctors. And then there's some combinations of functional medicine, integrative medicine, where you got a medical doctor that practices naturopathic medicine, stuff like that. So anyway, it's all kind of goes to the core of what's causing my health problems.
Yeah, and that's also leading to things that genomics and other testing of not only your heritage and stuff, but testing of how is your body absorbing things. Certain and I didn't know this until recently, right? That now we can test to see which particular medication is best for you because the way that your body absorbs something, and so that's where that type of medication or medicine, they use now those types of indicators to try to jump ahead of it and say, hey, not treat the symptoms, right? Let's get more on the preventative side of how, we're going to navigate around this.
Right. Is there anything I'm about out of questions, I guess. Is there anything that you can think of we haven't covered that you feel is important that you want to put out there?
No, I think the biggest thing is it's, as you said, next gen. So next generation healthcare. And it's putting the consumer in the driver's seat. How do they want to consume their healthcare? And all this is doing is giving them another path, right? I go to the airport, which I do many times, a year, and I get off the airplane, and guess what? I can get an Uber, I can get a Lyft, I can get this, but guess what? I can also go get a taxi. Still there. They line up, big old yellow cars. I know it. It's good. Traditional. Uber and Lyft is just an alternative, right? And so that's what we're bringing into the healthcare is a new way, a different way of taking care of the same things and making it convenient and getting the results and saving money along the way.
And I want to point out that it coexists. Everything we do at Next Generation Healthcare coexists with traditional insurance and traditional medical care. It's just an additional option that's available for utilization, and it helps reduce cost, adds convenience. It's got all the advantages we talked about, but it doesn't eliminate anything. And that's the other thing I'd like to make clear is that what we've talked about today in the way of virtual healthcare is primarily, it's totally focused on primary healthcare. There's two components to healthcare. One is your primary care, which is your gateway to good health. When I call your gateway to good health, that's the entry level where you find out what's going on, and your doctors guide you into anything more serious. When you get into more serious, when your doctor says you need surgery, you need this, you need that, then you get into major medical. And of course, that falls under the insurance umbrella as well. But in next generation healthcare, what you do is move from virtual into medical cost sharing. That's where communities, nonprofit communities get together and share medical costs. And compared to traditional insurance, it'll reduce your costs probably at least 50%, if not more. But it's not for everybody. For some people, traditional insurance is the best solution. But for many, a combination, the next generation healthcare solution, which is a combination of virtual healthcare, medical cost sharing, can be quite effective and cost effective for you as well. And it puts you in control of your own healthcare, giving you both access and control. And I don't mean to get into an advertisement here, because Next Generation Healthcare podcast is about educating you about what's available out there, whether you purchase it from Optimal Telehealth or another provider. We're here to make you aware of what the possibilities are. So thanks for joining us today, Wayne. This has been a fantastic discussion. How do people reach you if they need to connect with you?
Well, they can go to getlyric.com is our easiest way. Do
Okay.
inquiries, through there. Find out all the information, or go through your Next Generation, affiliates that, again, us being one piece, we really like people going to our affiliates because now they can round out with things like health share companies.
Okay. Thank you. In other words, go to optimaltelehealth.com and give us a call.
There you go.
Yeah. And let me throw in one last thing. Everybody wonders, gosh, what does this virtual healthcare cost? I'm going to share with you what Optimal Telehealth's pricing is, and you're going to find all kinds of prices out there. But we basically provide it in two different membership packages. There's an entry-level package. It starts at $15 a month for an individual, $25 for a family. Then there's a robust primary care package, which has got all the services, $35 a month for an individual, $50 for a family. So you're talking about a price range within the $15 to $50 range. So I wanted to quantify that for you, so you're not thinking you're going to wind up paying hundreds of dollars for these services. They are extremely cost effective. And for employers to provide an employee, even if you're young employees, with a $15 a month healthcare service, it's kind of a no-brainer. So I'll take my sales hat off now and thank you for participating, watching our podcast, and come back and see us next time. Thanks so much.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.